expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to the wonderful world of wellness with the famous Dr. Andy Mencia. Dr. Mencia brings you his own show, which brings you medicine and other wonderful products in the field of health every Monday night at 6:30 p.m. here on WNN AM 1470 Radio and live streamed on www.wonderfulworldofwellness.net. Brought to you by the Adult and Geriatric Center of Florida under the medical direction of the geriatrical doctor, Andy Mencia. Call and be part of the show at 888-565-1470 and let Dr. Mencia help you find a future with wellness.
Well, good afternoon and welcome back to the wonderful world of wellness. And if you're going to go into the internet, it's wonderful world of wellness, just like that, .net, N-E-T. We want to welcome our international viewer to our show. And we have a wonderful guest today. We also want to welcome our new site that is transmitting simultaneously live. You can also go to www.nn1470.com and you can watch through either side. Now, for our local callers, you can call 888-565-1470. 888-565-1470. For the international caller, you can call 1-561-988-5474. Welcome. I hope everybody have a wonderful weekend. It was Mother's Day, so I hope those of you that have your mother still alive and hopefully close by had a chance to spend some time and show some gratitude for all the things Mom have done for all of us. And to me, it was a great inspirational day. And I always write in my office an inspirational thought. It's not a quote that I take from the internet. I just get inspired. And the inspirational quote was based on the fact that Mother's Day was initiated by one lady. Her mom was in Virginia, and she wanted to show her appreciation, so she gathered all the family in 1908. And she said, let's get together and let's have a Mother's Day. And it became an international event. So for those of you that have thoughts and idea, like for example, getting into the coffee, making a business for yourself, it only takes one person with one dream, and then a lot of determination. So today I'm having my green tea for my energy, my well-being, and I think it's the green tea that keep me this young. Nobody believe I'm just 35 years old. Again, it was just my birthday this May. I've been 35 for the past 20 years. So you know that this is a Stroke Prevention Month. During the raffle, for those of you that have your phone number, remember I gave you the number. If you are driving, please be careful. I gave you the number. We are going to raffle a free stroke prevention kit that has a podometer and other things to help you be active. And also this week is National Neuropathy Awareness Week. That goes right along with neurology. So without further ado, let me introduce to our audience our guest of the day. Today we have Dr. Joseph, a podiatrist. She graduated from Barry University School of Podiatric Medicine, and have been working with us for quite some time now.
Correct.
We have been working together. Welcome, Dr. Joseph.
Thank you, Dr. Mencia. It's a pleasure. My name is Dr. Biblon Joseph. I'm a podiatrist, as Dr. Mencia mentioned, and being the week for neuropathy, I thought it was fitting for me to be here. So that's why I gladly accepted the invitation. It's a pleasure to be here.
It's such a pleasure to have you.
Thank
I've
you.
been, since we started the show, Dr. Joseph, you have to come. This is going to be great. You're going to have a lot of fun. And hopefully we have some of the callers and call in and they have, they have questions. But before we talk about neuropathy and all that stuff, what inspired you to go into podiatry?
Oh, this is something very dear to my heart. My grandfather was a diabetic, and he was always complaining of his feet being numb, having a sensation of ants crawling. So as a youngster, I could not understand. So when I became older and I looked and researched, so I decided that was the best field for me to go into, and that's how I became a podiatrist. It's close to my heart.
Well, I think when I look at and I interview people through the different shows that I've been doing, both through this station and the sister station WSBR, where I broadcast on Saturday morning at 7 o'clock in the morning, and I have interviewed so many people throughout the years. It's interesting when you see a doctor that become what they are because of some past history, something passionate you to get there. And I think that makes us different. My grandfather lived to 109, so that inspired me and that gave me the passion to become a geriatrician. And I do it with so much love and devotion, because seeing my grandfather getting to that age without taking medication and being active throughout his life, that was my inspiration. So I can understand. And I tell you, when you say about your grandfather having the ants crawling, I remember when I was a chief resident in Montclair, New Jersey, and I had one of the first year students that wanted to call a psychiatric consult on a patient.
Wow.
And I say, well, what is the reason of your psychiatric consult? And they say, the intern goes, oh, I think the patient is having some kind of psychosis because he say he has ants crawling in his feet. So I say, well, let's look at the chart, because one of the things I taught that student that day, that resident, because he's already an MD, he was just doing his resident to become an internist. I said, well, let's go. You always have the rule of thumb in medicine: before you call psychiatrist, rule out any organic causes before you call it a psych problem.
Exactly.
So we went back, and the guy had diabetes for over 18 years and pulling control for the past 4 years. So it was time for me to educate. I said, well, there's something that you're going to have to read before tomorrow morning, and it's all about peripheral neuropathy.
Right.
So your inspiration was your grandfather.
Exactly. And I think the point that you made was a very good one, because after I graduated Barry, I had a very good residency, because my residency, I had a 3-year surgical residency in foot and ankle, but one of the focus that we had was on limb salvage. It was diabetic limb salvage. So that was in itself an inspiration, because you have the disease, but you can see it on a person, and that could be a family member. So that was a turning point for me. I already loved what I was doing, but the fact that we did the limb salvage rotation, it made it fun, and basically you and the patient, we became like family.
Excellent.
So
yeah,
we had a lot to learn, so that was a great time.
Well, and in your field, it's like when you bang your little toes against the dresser or a chair, we don't think how important the little toes is until we hurt it.
Exactly.
And then we see that we have problem with balance, and or when you have an ingrowing toenail.
Exactly.
Something as simple as an ingrowing toenail can debilitate you and make you fall on your knee.
Changes.
Everything changes.
It's true.
Excellent. Well, let me take 1 second because I don't want to forget, because this is not script, this is all live, and I like to go from my heart as the question comes, just listening to you talk. I just want to take a second to congratulate Freddie Santori, my mentor and the producer of my show, because today is his 5th anniversary of doing what he does best, doing radio production, and now we are getting into live streaming. So I want to send a big congrats to Freddie Santori, to his wife and kids. Thank you for sticking by your husband, your dad, believing in his dreams, because he is he's opening doors, and he's helping a lot of people get into this media. And then, just like when you take care of a bird, he just let them fly away and then take the next one and take care of them. So a big congratulations for him for his
Freddie.
So going back, a lot of times people will think that back pain have nothing to do with your specialty, or hip pain or knee pain. What can we say about that?
We will say that everything in the body is connected. Sometimes your back pain is coming from your foot. It has to do with alignment. So if your feet are not aligned properly, it will radiate, and when it radiates, it goes to the next joint. It's going to be the ankle, the knee, the hip, and the lower back. So that's always a possibility that it's coming from your foot. So everything in the body is connected, and that's why we are also talking about neuropathy, and also how neuropathy would affect all these things. So podiatry, neurology, and internal med, geriatrics, we all work together to figure out the cause of the neuropathy, of the pathology that's there. So that's why it's very important to always give us a thorough history and never think that nothing is connected, because everything is connected as far as the body is concerned.
Remember, you can go to www.nn1470.com to log in. You can log in at the wonderfulworldofwellness.com. It's all about neuropathy. This is the week of awareness of neuropathy. And we are so happy to have such a wonderful, educated person with so much practice in the field of podiatry to help us and to help you understand the disease and how does it manifest. So when it comes to neuropathy, let's see, we got Mary from the chat room, and her question from Mary is, how can we reduce neuropathy? So let's go to the chat room and answer Mary's question. What are the kind of things we can do to reduce neuropathy?
We can do a lot of things. As far as neuropathy is concerned, you can decide, you and your primary care doctor, what are the best ways to do it. We can do it with medication. We can control your blood sugar so they can stay low. The lower they stay, the least damage that they make. And also, definitely, we have some medication that can help.
And also controlling their sugar if they have
Absolutely.
a problem with their sugar, checking their circulation,
Absolutely.
making sure that they have good circulation. And one of the things that people don't understand, we have a vascular specialist that works with us, Dr. Gonzalez, and he had done wonder for some patients because they have stricture of the blood vessel, which decreases the circulation and magnify the manifestation of neuropathy. So what he had done is great to be able to open the circulation, bring back the circulation to the patient. We have a little problem with the light, but we're going to fix that after the break because this is live, so we won't stop for that. So one of the things that I'm very proud of at the center, Dr. Joseph, is to have you and the dermatologist, Dr. Labovian, Dr. Gonzalez, the interventional vascular physician, and the group of geriatricians and internists that work there in harmony to try to tackle neuropathy in
the broader sense.
Exactly.
Because it's not just one component, right?
And, of course, we cannot forget our dietitians.
Absolutely.
They become extremely important
yes.
because otherwise we're going to end up with polypharmacy giving more and more medication. So the dietitian jump in that team, trying to become the coach of the patient so that they can help the patient then control the sugar. By controlling the sugar, then the thing that you and I and Dr. Gonzalez and the rest of Dr. Labovi and the rest of the team will do is basically to bring down the neuropathy. There are many things we can do, like insert and what have you. But before we get that far, let's stay with the question that Mary posted, because I think it's very important. So controlling the sugar is very important.
Correct.
What about medication? Any medication that can exacerbate the neuropathy or make it worse, or basically you usually leave that to me to handle that.
Right. Yes, because again, we're trying to prevent polypharmacy. There are medication that can help, but also it can interfere with whatever else you're taking. One thing that's very important, going back to Mary's question, keeping the blood sugars low. That's the main state to help with neuropathy. The way we do it, again, it's with your diet, education. It's a multifaceted way to make the changes. So definitely there are ways that we can limit the neuropathy. We don't want it to extend. So these are a few of the ways that you can do it.
Excellent. Thank you, Dr. Joseph. Wonderful information for all of those patients living out there. And peripheral neuropathy is not only induced by diabetes, so there are many, many more things to come. Other things that Dr. Joseph, can do at the office, and sometimes, when she need to take you to the hospital. When we come back, I'm gonna raffle the stroke prevention kit. One more time, the number is 888-565-1470, like the radio station. And the international caller, we will send it to you if you win, of course, is 1-561-988-5470. I don't know if we have a caller there on the line before we go on the break. Let's just quickly check, and if we don't, then we'll go ahead and let me check. Do we have a caller on the line? No. Okay, we don't. Okay, so let's take a short break, and we'll come back with Dr. Joseph, our podiatrist at the Adult and Geriatric Center, and we will continue to talk all about happy feet. We'll be back.
Tired of long waiting times at your doctor's office? Are you frustrated with driving all over to see your specialist doctor? Are you looking for compassionate and knowledgeable medical professionals who can truly help you? Look no further. Adult and Geriatric Health Center, under the medical direction of Dr. Andy Mencia, is a multi-specialty medical and dental center devoted to you. We have specialists in all areas: internal medicine, dentist, geriatrician, pulmonologist, cardiologist, podiatrist, neurooptometrist, ophthalmologist, neurologist, dermatologist, urologist, infectious disease specialist, dietitian, allergy testing, and hypnotist. Located in Fort Lauderdale, Florida on East Commercial Boulevard between Dixie and US 1. We are your one-stop shop for comprehensive medical and dental services. Check us out online, adultgeriatrics.com, and follow us on Twitter at AGI Health, Facebook, AGI Health Center, and LinkedIn, AGI Health Center. Call now to schedule your appointment, 954-489-1345. Do you know someone who drinks coffee? Of course you do.
get the free stroke prevention kit. Remember, this month is Stroke Awareness Month, and my philosophy of medical practice is always prevention. And this kit is basically toward prevention. You will get a pedometer that will track basically how many steps you take throughout the day, and other goodies there that comes in that kit, and you will receive that for free from us. So please call, and we will take the name of the fifth caller, and we will send you free of any charge the stroke prevention kit. Dr. Joseph, let's continue. So we're talking about neuropathy, and we were talking about medication that can, like Mary's question was excellent. We're talking about that. Now we have better lighting. Now you can see how beautiful my Dr. Joseph is. Dr. Biblon Joseph, tell me about in neuropathy. When are the symptoms? What are the symptoms that people should be looking for? So if I'm a diabetic and I hear this show and I listen to the show talking about neuropathy, what are the symptoms that prompt me to go and see you as a patient?
That's a very good question. The symptoms do vary, but the ones that we see that are the most common are heat. People will say, all of a sudden I feel like my legs are hot and I don't know where it came from. Ants crawling up the legs, that's another one. And also sometimes when you walk, you step on something, you don't even feel it. Those are the clues that are telling us that something is wrong, and those are signs of neuropathy. And when that happens, this is telling us also a story. It's telling us that the blood sugars have been very high for a long time. Those are the symptoms that we see most of the times.
And you know, that's an important one, the one you brought up about stepping on something and not feeling it.
Right.
I remember once seeing a patient that what he did, well, we have a call coming in. We'll get back to that. Let's take this call. Caller, you're on the line.
Hi, I am Renate, and I have a question to Dr. Joseph. My mother is diabetic, and she's 89 years old, and we lately get a lot of trouble with walking with her, and her feet, they're getting so stiff when she tries to walk, and sometimes they are very cold. Has this something to do with circulation, or is something wrong on her foot?
Well, what Dr. Joseph is getting ready to answer your question, Renata. I know you're calling from Germany, so I want to say, well, for you it's nighttime, so I was going to say Guten Nacht. Guten Nacht, wie geht's?
It's good.
Wie geht is good. Okay, Renata. 1 second, and let me have Dr. Joseph answer your question. And we are so happy that you are calling us from Germany. Hold on 1 second.
Thank you, Renata, for your question. Your question has two chapters. You're saying that she's not able to walk sometimes. That also has to do with muscular. Is she keeping up? Is she exercising? That's what I wanted to know. And also the other part of your question is that her feet are getting cold. That's definitely circulatory. And when we talk about circulation, the neuropathy comes into place as well. So if she's a diabetic and she's 89 years young, I would like to know how long she's been a diabetic. That will give me an idea of if the blood sugars have been controlled, how bad is the neuropathy. So to answer your question, yes, it's partly due to the neuropathy, and also we might have a component also of a muscular component. So definitely we have the neuropathy in there. The cold feet are circulatory and neuropathy combined.
Okay. And you know, Renata, go ahead, Renata, you can follow up.
My mother's sugar, she has it about 15 years, and the sugar was lately till December very high, knowing she had only on medication, and we changed it now and put her in insulin.
Excellent.
And since this time now, since 3 weeks, I gave her from Organo Gold the Ganoderma mushroom, the capsules. We finally got them in Germany. And since this time, the sugar went very good down. I don't have to inject too much insulin anymore.
Very good.
But the problem is still she tried to stand up, and then she suddenly cannot stay anymore. And she moves her leg, sitting in the wheelchair and walking all day long around and sitting in the wheelchair,
Right. So definitely, it's good that now the blood sugars are controlled. That she's gonna feel better. The neuropathy is gonna get a little less, because the higher the sugar, the worse it is for the neuropathy. When the sugars are controlled, the patient is gonna start feeling better. She will tell you, you know what? Now I'm having more sensation. I'm feeling a little better. She will be able to give you these answers. But I am very happy that we are controlling the sugars better. Right now, what I want you to do is, at the end of the day, to always check the bottom of her feet for any red area, any areas where she's putting a lot of pressure, because also that will tell us if the neuropathy has gone too far. So if she's putting pressure and she's not feeling it, we also need to be on the lookout for that. But definitely, I'm happy that the blood sugars are down, and for you to continue doing what you're doing. And at some point, you will see, using the Organo Gold and also the other medication, we might have to decrease on the insulin if she's controlled properly.
Absolutely. Absolutely.
Thank you for answering my question, and I look after the feet if they are red, but I didn't see it that there's some pressure on it.
Okay, great.
And I also want to thank Dr. Mencia, because I take this Organo Gold too, and I have some problems with allergies, and I take the Mycelium, and it went better. So this thing is miracle.
Thank you, Renata. I'm very happy. I'm so happy. Yeah, so happy that this is working for you and for your mom. And I do go to Germany, and I do attend to patients there privately. So it's wonderful to hear that this product that is finally, after the big meeting that took place in Italy, finally you guys in Europe, all of Europe, are able to get all the capsules that before the meeting were not available. So I hope you continue to use them and enjoy them. And for those people that just heard Renata giving her history about and her accomplishment with the capsule, if you want to look at the product, the website is www.mencia, M-E-N-C-I-A, cafe, C-A-F-E.com, menciacafe.com. You can go in the site for the international viewer. If you go on the right hand side, upper right hand side of my website, there is a area where you can click where it says language and country. You open that little window, and it will put your country, and you can then transfer my whole website into your native language, or English if you so prefer. So thank you, Renata, for your call, and I'm happy that the products are working for you also, as many of my patients have said. Thank you so much for your call, Renata.
Thank you very much.
Thank you, Renata. We have another question. What are acceptable blood sugar level?
Exactly. Yeah.
So anything that is below 100, between 75 to 100, you want to stay there. And we have a little anecdote. I have some of my patients. It's like, oh, my sugar has been great. I said, what are the numbers? She's like, 250. I'm like, no,
that's too high.
That's too high. We don't want anything in the 2s or the 3s. You want it below 100, between 75 to 100. It used to be 80 to 100, but we're trying to be stricter these days.
Yes, absolutely. And the thing what diabetic patients need to understand is that we are not being tough on you. All of the research have shown that when a person do whatever it takes to bring that sugar down to normal range, listen to me, you will not suffer of any of the complication of diabetes. You will not lose your toes, you will not have the neuropathy, you will not lose your eyesight. I wrote the book on the kidney. You will not have renal failure. You will not have a heart attack. You won't suffer a stroke because of diabetes. Once you normalize the sugar, then even though you are a diabetic, the sugar being normalized, it does not become a risk factor any longer to any of the complication of diabetes. That had been proven over centuries already of research. The pile of research we can fill this room, well, it has proven that it is extremely important that we attempt to the best possible to control the sugar. Once we do that with proper diet, that's why it amazed me, knowing that in our practice we have wonderful dietitian, and people will not take advantage of that. And they will go to a nutritionist, and they will go to the gym and see a nutritionist, and they will pay out of pocket when the dietitian is basically covered by your insurance. It's a free service for you. It's something that your insurance will cover for, and then this person and myself become, on that aspect of your care, we become your coach.
Yep.
Because people will say, well, I have a wedding coming up, or I have a party coming up. How do I handle this? How do I best handle this so that I can enjoy and be normal and do everything everybody else is doing without harming myself? So that's a great question, and it sounds tough, but believe me, for those of you that do want to be proactive in preventing any of the damage that diabetes can do to your feet and other organs, is basically excellent sugar control. The
Absolutely.
better control you have it, the better.
The better.
And following on Freddie's question, for those of you that check your sugar postprandial, after you eat, you want your sugar to be under 200. So if you check your sugar after you eat and your sugar is 400, something is wrong with your regimen. Your sugar should be under 200 after you eat, and then that means that whatever you are doing with your diet and your regimen, you are doing a great job, and I will congratulate you for that. So before eating, we gave you the numbers. After eating, we gave you the number. And it's not to starve yourself to death. That's not going to help you. On the contrary, you want to eat frequently. You just want to eat well, so that you are not forcing your pancreas to overproduce insulin because of the deficiency of insulin that we already have in the pancreas. So continuing then with the neuropathy, we spoke about some of the medications. Some of the medication that can harm you is if you are taking a medication to slow down your heart, and it slow down your heart too much. I saw a patient on Saturday that the heart rate was in the low 40s, and basically she was having a lot of neuropathy, so I was going to schedule her to see you. But when I'm doing my physical examination, I say, oh no, it looks like we're going to have to adjust the medication, because the beta blocker the dose was so high on the patient that it slowed down the heart so much.
Right.
Now, in order for the nerve to function, we need blood, we need oxygen.
Absolutely.
So if we slow down the heart too much,
which is the pump.
Yes, then we need that pump. You need that pump to help you. So decreasing the pump too much is not good for you. If the heartbeat is too high, that's not good for your heart. But with regard to your feet, now one thing that I want to bring up, I don't want us to neglect, is that when it comes to the sensation, and I was going to say before we have the caller coming in, I don't want to forget this. I remember having a patient that came in with an ulcer underneath the sole of the feet, right on the sole of the feet. It was one of his feet, and we asked what happened. You know what happened to this guy? One of his kids playing took a coin and it fell on the shoe. The kid couldn't find the coin, so he went on to put on his shoes, and because he had low level of sensation, he didn't feel the coin. So he put on the shoes, he went to work, he was moving around, working. When he took off his shoes, he took the coin out of the sole of the foot and it was a huge ulcer underneath there.
Oh, we see that all the times in the hospital. I get called in the hospital, young, 45, 48-year-old, diabetic, a little corn, they pulled it. And now we have an infection, which is called gas gangrene. Whenever we have gas gangrene, we're looking at amputation. So when we have neuropathy, we have to be very careful. When I say to take a mirror and check the bottom of your feet every night, it's true. I have seen ulcers develop, and the patient did not have a clue that he or she had an ulcer. And by the time they come to me, it's to the bone. Whenever bone is exposed, we have to amputate, unfortunately. And one thing that I want to mention, the sugar level, the reason why we are stressing the fact that they have to be low, it's because we have what's called proprioception. The proprioception is the fact that you can walk without any problem and you know where your foot is in space. When we walk, we don't look at our feet, but when the blood sugars are high, all the times, we start losing the proprioception, we have the neuropathy, we lose the ability to know where our foot is in space. That's what happens. That's how we hurt our feet. We step on sharp metals. We don't know where we're stepping. And usually these are catastrophic. They have catastrophic results. So that's why we are stressing for the sugars to be low. Because research has proven if your sugars are low, definitely your sensation will stay the same or it will improve. So it is in our best interest to keep the blood sugars low.
Well controlled, yes.
Well controlled.
Well controlled.
Thank you. Well controlled.
Yes. Oh, that's so informative, so interesting, Dr. Joseph. What other conditions we can talk about? We talk about the neuropathy, but before we leave the neuropathy, I call neuropathy of the lower extremity of the feet the Alzheimer, the dementia of the feet. And the reason I call it the dementia of the feet, because when we become demented, we lose the connection between the brain and the rest of the body. So when we are demented, if your bladder filled up, the signal are going to your brain to tell you that you better run to a bathroom because the bladder is already filled up. You got to empty your bladder now. And then the brain will send a signal to the sphincter and say, hold tight, and you start running, and then you release the sphincter so you can pass the urine, and then you are okay. With the feet, when you imagine when you get an ingrowing toenails. If you get ingrowing toenails, you know how sensitive that is from the very beginning. And what you do, you go running to Dr. Joseph, or you go for a pedicure and what have you, or you go to a doctor. You're trying somebody to help you release the sensation. When you are a diabetic, you get the same ingrowing toenail that everybody else is getting. Guess what? You are not feeling it.
Right.
You are not feeling it. And that's how come the ingrowing toenail that is red and puffy, and you let it go because you have ignored that. It only takes about 2 hours, no more than 2 hours, less than 2 hours, for the redness and puffiness of an ingrowing toenail to become black. Black means dead tissue. I mean, now that tissue is dead. Now we have to remove all the dead tissue, and that's where Dr. Joseph, we have to take you probably to the hospital, put you on a antibiotic, and pray hard that infection have not gone to the bones. Because once it had gone to the bones, now we're talking about osteomyelitis. That's months and months. I'm talking at least 8 months of therapy to try to salvage a bone that is infected. But a lot of time when that necrosis or that dead tissue take the entire toes, that's what Dr. Joseph is referring. That's amputation. That toes need to come off because dead tissue is dead tissue. No ganoderma, none of that stuff is going to help you. So preventive, check your toes. You have a mirror. Use a mirror. Create a pattern. It could be when you are sitting in the toilet. When you are sitting in the toilet, that's when you grab your mirror and you check your feet. Look at area that you cannot see without a mirror. Just go through your feet and memorize the different bumps and
the heel,
and
the
heel.
ball of the foot, wherever you see those pressure points, that's where you look. So definitely, because we've seen that when you have redness, it's telling us there's pressure. And with neuropathy, we are not able to feel it. So that's where the mirror is going to become your best friend. You check the bottom of your feet, make sure there's nothing open, blisters. These are all things that we have to look out for. I want to take that chance to also, I'm going to try to illustrate a little better. Let's say you take a glass of water and you put sugar. After a while, it's sugar water, but if you put too much sugar, the sugar goes and settles down. So picture this in your body. Your sugar level is very high. There's no more space for it to go to. So where it's going to go? It's going to go on top of your nerves, on top of your blood vessels.
It's going to precipitate.
Exactly. So when it precipitates, it goes on top of those vessels. It does what we call glycosylation. They become very brittle. So that's why the nerves don't work the way they should, because you have too much sugar in the body. Same thing with the blood vessels. When the blood vessels don't work the right way, the first blood vessels that are affected are the smallest one. We're looking at your toes, your fingers, your eyes, your kidneys. So these are the ones that are affected. So it's imperative that we keep the blood sugar levels within normal limits, because we don't want that extra sugar to precipitate and go on top of your nerves or your blood vessels and do what we call glycosylation. Whenever the sugars are on top of those vessels, they would not function the right way. That's where the diabetes starts, and that's where the circulatory problem starts. We see that all the times in the hospital. The blood is being pumped by the heart, but it's not reaching the smaller vessels, which are the ones to your toes, to your eyes, and to your kidneys. What's
affected the most by diabetes, right? What about shoe wear and insert? I know in the office we do order those custom-made inserts for the patient. How important is in a diabetic patient shoes wear?
We look at the foot type. Everybody's different. It's like your finger. Your fingers, everybody is different. So we look at your foot type, and we make custom-made inserts for you with cushions where you need it the most. If you need it on your heel, that's where we're going to accommodate.
So it's like going to the eye doctor and getting custom-made glasses.
Exactly.
Because the right foot and the left foot, they are not the same. They are different.
They're different. So we do custom-made. We make sure that the pressure points are being taken care of, because we want to relieve the pressure. Wherever you see pressure, with neuropathy and bad circulation, there's a chance that it's going to break down. Whenever the skin breaks down, we're looking at a wound. It's an ulcer. And with diabetes, everything that will take probably 2 weeks to take care of, with diabetes, we're looking at 2-3 times the amount of time. So that's why we are stressing prevention. And prevention starts with control of your blood sugar level. There are no ifs and buts. That is the first and foremost thing that we have to do. We need to keep the blood sugars at a normal level. And
also, it's important that, God forbid you bump your toes into something, you have an ingrowing toenail. If you are a diabetic or if you have neuropathy, to us in the center, it becomes a medical emergency. Why? Because we are very aggressive with prevention.
Yes.
So don't wait for a week to come in. Let me see what happened. Come right in. Just get a check. At least get us in the situation from the very beginning.
From the get-go.
So that we can work with you. Sometime before you even see Dr. Joseph, you might see me, and I might start a regimen until you see Dr. Joseph, and then we move forward from there. Other condition that I think is important for you to know is about other conditions that Dr. Joseph treats. So let me give her a chance, because we are about to close, about the end of the program, about what other condition patient can come and see you for at the
We have
office?
a couple of hours left.
we have 5 minutes.
We treat from ingrown toenails to plantar fasciitis to foot sprain, ankle sprain, leg swelling, runner's foot, athlete's feet. We treat a variety of conditions in the office, and compounded with the fact that one can be a diabetic, we have to treat it from the get-go. We cannot let anything for tomorrow, because especially with diabetes and neuropathy, half a day, it's like losing a week. So we have to be very diligent about taking care of it. So we do treat a variety of conditions in the house, like I said, sprains and strains of the foot and ankle, swelling of the leg from your toes, and fungal toenails, calluses, hammer toes. We do surgery for bunions and hammer toes, and also flat feet. This is another topic, and it's on its own.
Yes.
Because we have kids that are born with flat feet, and also we have flat feet that is acquired with with everyday life. As we progress and age, we see flat feet. So this is also something that we treat in the office.
Excellent. And calluses?
Absolutely.
Calluses
are not always just calluses. They can become wound. Everything to us is of importance.
So, if you do have calluses, the worst thing to do is to try to learn to live with them. You have to get rid of them. The sooner you tackle your calluses, trust me, especially if you're a young person and you give yourself 20, 30 more years from today, those are the calluses is the one that will deform your feet. You see some people that they are big toes, start moving in, and the feet get all deformed. Calluses will help you develop or worsen osteoarthritis of the feet, and the complication can be very severe, and the solution, if you have simple calluses, it can be easily fixed, and all you have to do is do maintenance on your calluses. Now, as a professor of medicine, a lot of people think that dentists, they only have to deal, when they go to school, they only they learn only about the mouth. So if you ask them anything outside the mouth, they have no knowledge. And dentists, they study from the neck up. In your field, you study from the knee down.
We do soft tissue from the hip down, bony surgeries from the knee down. That little bone that we call the tibial tuberosity going down. So from the tibial tuberosity, we do from fractures of the fibula or tibia. We can put external fixators. We can treat wounds. We can treat your bunion and hammer toes, like Dr. Mencia was mentioning. Sometimes you see your second toe going over the first, or vice versa. That's telling us there's something wrong. And most of the times also, it has to do with what we call the biomechanic of the foot. So that's why we don't do cookie cutters. Everybody gets a thorough exam.
Exactly.
And we decide the best way to help or to prevent any more bony deformities.
Yeah, I guess, with the team that we have there with all the medical assistant, the excellent medical assistant that we have there, Oscar and Homer and Juan and Vionela, and with all the assistants that we have there, and then you as one of the experts, and Dr. Gonzalez, I have seen some miracle done at my center thanks to all of you with wounds. I have seen people with wounds that had been corrected, where people have gone to University of Miami and other places trying to get help, and they have come to our little center, and we have done miracle. So I do want to thank you for all the services you have done, not only on my behalf, but on behalf of all of those patients that you make them so happy, and you bring them happy feet to their life. And I want to thank you for listening, and I hope this has been a highly educational program for you. That's always my intention, to bring the information for you. And if you don't come to the center, when you do go to your primary care doctor, when you go to your podiatry, please consider looking into prevention, especially for your feet, because poor care of your feet can eventually affect your lower back, it can affect your hip, it can affect your knee. So taking good care of your feet, where your balance land, usually the center of gravity on each one of us is different. It's like our fingerprint. Well, guess what? As time move on, when we gain weight, when we lose weight, when we hurt our back, that center of balance tend to move. Some of us have old shoes that we love because we got them 100 years ago, and we say, they are so close to us, they are so dear to us that we don't want to let go of them. That might be okay, but your shoe wear is something that you need to change frequently, because after all, it's your feet, and they are going to affect your feet. So I think that's very important that people realize to change their sneakers. And
absolutely, and your feet do change
with time. Okay.
So we have to look into, if you have a shoe that you love but it's been there for 10 years but it doesn't fit the same way it did 10 years ago, so we do change.
So for the National Neuropathy Awareness, Stroke Prevention Awareness, please keep in mind this topic. You can always go back to the wonderful wellawareness.net, NET, and review any of the talk that we have in this show or the guests we have had on the show. Go back and review it and take note, and whatever it takes, feel free to contact us. Our Twitter account is AGI HEALTH, HEALTH, AGI HEALTH. You can send us tweets, keep us with your account, keep us connected, and it has been a great show again. In my closing, I'm happy. In my closing, I'm happy. I didn't forget. I already put it forward. I'm just going to say it at the end. We want to say thank you to Mr. Freddy Santori and his family for his wonderful and productive 5th anniversary. And from the bottom of my heart, I wish him and the family the best for the years to come. And I know that he has a lot of potential, and I just hope God guide him in the right direction so that we can all benefit from his wisdom. May God bless you all, and we'll see you next week. Have a wonderful week. Take care.
You have been listening to The
Goodbye.
Wonderful World of Wellness with Dr. Andy Mencia, who is a 2-year fellowship-trained geriatrician and owns a large, multi-specialty geriatric center in Fort Lauderdale, Florida. He believes in caring for the elderly in the most compassionate way, and to that end, he created the center with them in mind. Join Dr. Mencia every Monday night at 6:30 p.m. on the WWNN 1470 Radio TV network and on his website at www.wonderfulworldofwellness.net to ask any questions on the many topics he covers. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily